Alex, can you tell us about your role at LendingTree?
Sure. I'm LendingTree's benefits manager, and that means that I get to oversee all of the outstanding benefits programs that LendingTree has put into place over the past several years. Benefits, I think, often get siloed into just kind of medical, dental, vision, when in reality, I get to run a lot of fun programs like our wellness program, employee relief fund, fitness reimbursement, and then, of course, our Tryon Direct primary care relationship.
How long has LendingTree evaluated direct primary care?
So the idea actually started a couple years ago at a Christmas party. The CEO brought up the idea of having a school nurse function on site. So we really started to evaluate it more seriously about a year later, and it turned into this idea of direct primary care, not just having a nurse practitioner on site, but really having kind of the full spectrum of care available to our employees.
What made you choose Tryon Medical Partners?
So we went through a pretty extensive RFP process with some other vendors, but Tryon really quickly emerged as a clear front runner to me. What really shone through was Tryon's indisputable passion for their patients. And quality of care is my number one priority for my employees. And so I knew really from the beginning that we were going to be great partners.
What benefits of Tryon Direct do you feel met your company's needs the best?
I think the most important component of Tryon for me was really the flexibility. So it wasn't just we weren't just being offered one provider on site. We really have access to all 67 physicians in all 7 specialties. So people being able to access those physicians from wherever they are, and especially given the work from home kind of hybrid climate that we experienced in 2020 and even into 2021, that was really important, that employees can see the provider who's nearest to their home versus driving into the office just to see the provider that we're offering. And another benefit Tryon was able to offer is diversity of providers. So we can't have a cookie cutter, one size fits all solution. I may want to see a different provider than you. Everyone looks for something a little bit different in their providers. And so that was a really big benefit to us, is our employees having access to all the different providers in the Tryon network.
How did Tryon Direct stand out compared to other solutions?
Throughout all of COVID, since it hit, through the vaccine rollout, Tryon has just been such an excellent partner to us. They offered testing solutions for employees who were still having to go on site to build this beautiful headquarters, and then offered an incredible vaccine rollout to our employees as well. Tryon helped with communication. We had a webinar with Dr. Owen to help with misinformation, and it's really anything that we could have asked for, we got in a timely fashion, and I think it was incredibly helpful to our employees, and it was helpful to me as a benefits manager.
Can you tell me about some feedback that you've gotten from your employees so far?
The feedback so far has been exceptional. I work with a lot of really tremendous vendors, and I can tell you that we hold our vendors to a very high standard. I could sit here for hours, honestly, and talk about all the positive feedback that I've gotten. But I think a really important trend emerged, that our employees are able to see the doctor. They're able to talk to the doctor. They're able to spend time with their physician, which really isn't the norm now in the health insurance world. People are really worried about what's covered under their $0 preventive visit exam, and that's just not something that our employees have to be worried about, which to me is just better healthcare.
And can you give us some feedback from your leadership team on their thoughts on Tryon Direct?
The leadership team really believes in this concept for our employees. The direct primary care model and the on-site clinic differentiate LendingTree in the labor market, which is tight right now. And it's important not only for employee experience, but for retention, for reduced absenteeism, and then increased productivity.
What would you tell other employers that are considering offering direct primary care?
So I would really encourage employers to look at their primary care spend. Primary care is really an underutilized function of the healthcare system. Primary care is responsible for chronic conditions, medication management, and really the entire flow into the hospital system. So if your primary care spend is low, that's a problem. You might not see the problem now, but it will be a problem later on down the road. So investing in primary care really is an investment in the future.